Hi, this is Dr. Hussain from My Hair Clinic. This video is a part of a series of videos on hair loss and different aspects of hair loss. Today we'll be talking about causes of hair loss. Hair loss is rather common. 20% of men in their 20s would have hair loss, and it goes with that decade. So a person in his 50s would have a 50% chance of hair loss, and 80% of people in their 80s have problems with hair loss. So it's a pretty common problem, and it increases with age. There's really no age where you can say for sure that there will be no further hair loss. As a population, in the individual patient, you might be able to say that there won't be any further hair loss if you've reached the horseshoe shape pattern. Causes of hair loss, it's a wide subject. Obviously we won't be able to cover everything, and we won't be able to go into details on everything. This will not be videos on a very detailed explanation on causes of hair loss. It's basically an introduction to the subject. 90% of hair loss in men, and quite a substantial number of women, have hair loss from genetic reasons. We call it androgenetic or androgenic alopecia. In men it's roughly 90%, and in that case we call it male pattern baldness, MPB. In females we call it female pattern baldness, FPB. Now, androgenic alopecia has a different way of expressing itself in men and women. In men, it can have a lot of it has a lot of different patterns. You can have only high temples, a receding hairline. You could have hair loss only in the crown. You could have a combination of those with hair loss in the front, in the hairline, a receding hairline. You can have high temples with a balding crown. You can also have diffuse thinning. You can have a diffuse thinning with one of the other bald areas, high temples, bald crown, etc., etc. So there's really no fixed pattern for hair loss in men. In women, it's less common with completely bald areas. It's less common with proper temples developing. It's less common with a proper crown being bald. It's more common with a more diffuse hair loss, and not only hair loss in the front top or the crown area. Even in the sides and the back of the head, women can often have hair loss. So, but they are both due to genetic reasons, and you'll see that there will be other people in the family having the same problem. It can be inherited from the mother's side, or it can be inherited from the father's side. There's really no way of knowing, and it can also be from both sides. A major involvement of hair loss, genetic or androgenic hair loss, is a major factor is dihydrotestosterone. Dihydrotestosterone and testosterone is found in men and women. In men, it's produced in the testicles, and it's converted into dihydrotestosterone. Now, dihydrotestosterone is a part of our body. It's a natural thing. It's not really anything that is as per se harmful. It needs to be there for certain reasons. But it can have undesired effects, and we would not be considering hair loss a kind of a disease, although it can be quite upsetting. The follicles in the front, top, and the crown of the head in men, and in women it can be a different matter, but in men we have follicles that are sensitive to DHT. That sensitivity to DHT can vary greatly. Some follicles may be able to bear with or deal with DHT at a certain level for a certain time. And once that level or that time frame has been exceeded, it may lead to hair loss. And they'll be part of the initial hair loss, the first hair loss you see, the first receding of the hairline, or the first thinning in the crown. So those follicles were more sensitive to DHT, and they couldn't take DHT at that level for that long. There'll be other follicles that can take DHT for a longer time, and even other follicles that can take it for quite a long time, and they may not even ever fall. Usually the hairs on the sides and the back of our head and the body hair is not sensitive to DHT, and they're there lifelong. Now, when hair loss starts, it's not like it just happens. One day one hair is growing and the other day it's not. It actually is a matter of hair being thinner and thinner, and ultimately stops growing. And the effect on the thinning is seen in the sensitivity in DHT also. So anyway, that was a detour. Other causes of hair loss apart from androgenic or genetic issues, we have some factors that are really not considered diseases. They're just part of normal development. Especially in women, we have hormonal changes throughout life. In the first instance, we have the menarche or puberty, when the girl starts having periods. Often it's 10, 12, 14 years of age. It can even be sooner than that, it can be later than that. But around somewhere then, there are changes in the female body, and along with those changes is the development of the breast, pubic hair evolves, fat distribution changes, growth and so on. These hormonal changes can also lead to hair loss or impact the hair growth. Later in life, with pregnancy and after giving birth, we again have some dramatic changes in the hormones in the body of the female. Those changes can again lead to hair loss. In the later stages, when women reach midlife and they reach the menopause, where the period stops coming, it again leads to a number of hormonal changes that can impact on hair loss. Obviously, these are natural. This is a natural part of a woman's development. This is not considered in any way, by any means, any illness or medical condition. It's a part of their natural development, but even though it's a part of their natural development, just like the production of DHT in men, despite being a part of their natural development, it can also lead to hair loss. Apart from the natural development in women, we do have medical conditions that can lead to hair loss that can be seen in men and women. Although the first is polycystic ovaries. In case of polycystic ovaries, we do have a number of hormonal changes also. That would not be considered part of the normal development, but polycystic ovaries can lead to changes in the female body and the hormones in the female body, leading to hair loss also. It's a relatively common condition, and we do have some ways of trying to treat it. And if you are suffering from PCO and you are suffering from hair loss, it would be a very good idea to see a doctor for treatment. Another relatively common cause of hair loss is the thyroid, dysfunctions in the thyroid. Whether the thyroid is hyperactive or whether the thyroid is hypoactive, if it produces too much thyroid hormone, or if it produces too little thyroid hormone, in both cases it can lead to hair loss. Fortunately, in most cases we are able to treat it, and there are good chances that it would revert back to normal, and it will also improve the situation with hair loss. Autoimmune diseases can lead to hair loss, particularly alopecia areata is considered or thought to be an autoimmune illness, and we'll talk about alopecia areata in far more details and the treatment options available in another video. Anemia can cause hair loss. Anemia is often seen in women along with iron deficiency. and is seen in women with heavy periods, leading to a loss of blood that the body cannot cope up with unless if the woman takes iron, or in some cases even other treatments may be required. So, but anemia from other causes can also impact on the status of your hair. It can also lead to hair loss. Systemic diseases, notably cancer, but also other systemic diseases, systemic chronic diseases can lead to hair loss. They can lead to hair loss, or the treatment of those diseases can lead to hair loss. Trauma can lead to hair loss. As other reasons of hair loss can be medicines. Most commonly known is chemotherapy. Chemotherapy can lead to hair loss and even complete loss of the hair, and the patient may need to wear a wig through that period. Usually hair from chemotherapy will grow back in 6, 8, 10, 12 months time. In some patients it can also lead to weakening of the hair follicle quite considerably, and we have had cases with patients having chemotherapy and afterwards the hair follicles were so fragile that we're not really able to extract them. Immunosuppressants, most commonly known as the steroids, but there are a number of other immunosuppressants. They can lead to hair loss, and steroids can lead to a number of other side effects, quite a few side effects. But they're also very important medicines. We need them when we, usually they're quite important when we decide to give steroids or immunosuppressants. Substance abuse, alcohol and smoking separately can cause hair loss. One of the ways we know of that is identical twins living in different environments, being adopted by different families, having different lifestyles. We see that it leads to hair loss also. Other factors can be psychological stress, severe psychological stress. Sorry. Severe psychological stress can lead to hair loss, and it can in some cases be quite dramatic. If you, with the loss of a very loved one, you can go into such a kind of a psychological reaction or depression to an extent that you have quite extensive hair loss. Any physical trauma, any physical stress to the body, it could be an accident, anything that really takes a toll on the body can impact your hair. It can lead to hair loss, and it can be quite severe. In some cases, psychological or mental trauma or physical trauma can cause telogen effluvium that can lead to very dramatic, very obvious hair loss in a very short time span. Otherwise, the development of hair loss is often very slow. In some patients it can be faster though, but it's not in few days' time. It's usually over a longer period of time. There are certain misconceptions of what can cause hair loss, and I think we need to touch upon that also. A common misconception is that long hair can lead to hair loss. We don't really have any evidence to support that. There's really nothing that supports that. Some people believe that only the maternal family history is that relevant, so that if you have hair loss within your amongst your maternal uncles, then you could have hair loss. That's not really the case. You can inherit hair loss from your mom's side or your dad's side. In both cases, it can lead to hair loss in yourself. Shampoos, conditioners, they don't really lead to hair loss. The shampoos and conditioners that are out there in the market, if they're used as they're supposed to, they don't lead to hair loss. Other dyeing products, perming products, they don't cause hair loss. However, if you use any chemicals, any products, without following the precautions, say if you need to leave a chemical in the hair for 8 minutes. You leave it on for 20 minutes for better effect. It is a chemical, there's a reason why it says 8 minutes, and you should really try to follow the precautions, and you might even, if you're particularly sensitive, you might even need to cut down on that. So if you use any chemical, any dyeing product, permanent product in your very own way, and you do not follow the precautions, then it could lead to hair loss, but that's not the normal use of it. Under normal circumstances, the most products, or nearly every product you can find in a store, would be safe to use. Another very common misconception is that poor circulation leads to hair loss. Now, the scalp and the face is one of the best circulated areas in our complete body. One of the reasons that in case of a cut or wound in your scalp or the face, we don't need to keep the stitches in for more than 5, 6, 7 days is simply because it heals so well. And we also see after hair transplantation, healing is quite remarkably fast, especially in FUE that we use at my hair clinic. So the fact that the healing is so fast is just one indication that the blood circulation is actually quite good. And even when we do the surgeries, even a simple injection in the skin often leads to quite a bit of bleeding. The scalp is quite well circulated, so that is not a cause of hair loss. I think this is enough for today. Obviously, we just touched upon causes of hair loss. We cannot go into details, everything we can't do here, and we need to, in each case, to look at the patient, try to see and understand whether we need to do any workup or not. In most cases with men, it's rather easy to establish whether or not it's androgenic alopecia, and if it's androgenic alopecia, we can in most cases we can go directly into treating the condition. In women at my hair clinic, we more or less always require a number of blood tests, and we do other tests as needed, unless if it's rather obvious and we are quite certain about the diagnosis. Otherwise, we would need quite extensive workup before we decide what the diagnosis is and before we decide what treatment we need to initiate. So the reason we need to know what the causes of hair loss is simply because that is what will guide us in the treatment. If you have any questions, if you have any suggestions for us, if you want us to make a video on a particular subject, you're more than welcome to write us at info@myhairclinic.com. You can also contact us on +92 32 11 554 554. Thank you.